Question 1. A 45-year-old man presents with painful blisters on his oral mucosa and skin. He reports that the blisters began in his mouth a few weeks ago and have since spread to his chest and back. On examination, there are multiple flaccid bullet and erosions on his trunk. Gentle pressure on the skin causes the superficial layers to slough off. Nikolsky sign positive. A biopsy shows intraepidermal acantholysis, and direct immunofluorescence reveals intercellular IgG deposits in a net-like pattern. Which of the following is the most likely underlying target of this patient's autoimmune condition? A. Hemidesmosomes. B. Desmoglein 1 and 3. C. Epidermal basement membrane. D. Type 7 collagen. E. Laminin. Correct answer B. Desmoglein 1 and 3. Explanation: Pemphigus vulgaris is an autoimmune blistering disease caused by IgG autoantibodies directed against desmoglein 3, and in some cases desmoglein 1, components of desmosomes, which maintain keratinocyte cell-to-cell adhesion. This leads to intraepidermal blistering and a positive Nikolsky sign. A. Hemidesmosomes, incorrect, targeted in bullous pemphigoid, not Pemphigus vulgaris. C. Epidermal basement membrane, incorrect. This refers more broadly to the dermoepidermal junction, not the specific target in Pemphigus vulgaris. D. Type 7 collagen, incorrect. This is the target in epidermolysis bullosa acquisita. E. Laminin, incorrect. Laminin is a basement membrane protein implicated in mucous membrane pemphigoid, not Pemphigus vulgaris. Question 2. A 50-year-old woman complains of several weeks of painful mouth ulcers and recent development of skin blisters. The blisters are easily ruptured and lead to painful erosions. Physical examination reveals widespread erosions and a positive Nikolsky sign. Skin biopsy demonstrates intraepidermal splitting. ELISA testing is positive for IgG against desmoglein 3. Which of the following best distinguishes this condition from bullous pemphigoid? A. Location of blister formation within the skin. B. Presence of eosinophils in histology. C. Presence of urticarial plaques. D. Linear deposition of IgG at the basement membrane. E. Sparing of mucosal membranes. Correct answer: A. Location of blister formation within the skin. Explanation: Pemphigus vulgaris causes intraepidermal blistering due to anti-desmoglein antibodies, while bullous pemphigoid causes subepidermal blistering due to anti-hemidesmosome antibodies like BP180 and BP230. B. Presence of eosinophils in histology. Incorrect. This is more characteristic of bullous pemphigoid. C. Presence of urticarial plaques. Incorrect. Seen in bullous pemphigoid. D. Linear deposition of IgG at the basement membrane. Incorrect. Found in bullous pemphigoid, Pemphigus vulgaris shows a net-like pattern. E. Sparing of mucosal membranes. Incorrect. Mucosa is commonly involved in Pemphigus vulgaris, unlike bullous pemphigoid, which usually spares mucosa.